Hey guys, welcome to our video series. Today we have a new guest speaker, Mrs. Manmeet Dhody, who is an RCI registered clinical psychologist with an experience of more than 8 years. Her professional and research focus include mental health advocacy and the role of resilience in mental health. So let's ask the first question. What is substance use and abuse?
Right. Although the statement that these two terms are used interchangeably, I'll also highlight how there is a difference in when and how to apply them. But to give you a very important and general idea, substance use disorders, as we call them clinically, occur when an individual uses substances that basically cause some sort of an adverse or harmful effect to many areas of their functioning. It could be cognitive, it could be physical, and definitely behavioral. The term substance abuse is also applied sometimes to basically highlight the factor that an individual recognizes that this particular substance that they have ingested or have been using is harmful to them, and yet they continue with it. So although this is also clinically identified, most experts prefer to avoid stigma related to the individual. They prefer to use substance abuse disorders. There could be many substances that are included in it, and they can be legal as well as illegal. So there is a very common misconception of sorts that if a substance is legal, for example, certain medications, but under substance use disorders, we always consider the effect the substance has on your body, and in the condition of a legal substance, for example, medication, it is not coming under the scrutiny of a professional, despite being sort of tapered off that medication or being asked to stop. An individual may continue to use it, and then it is classified as the sort of illicit use of even a legal substance.
So how do factors of peer pressure get involved with substance use or abuse?
That's a very important question when it comes to basically, I would say any individual, because we all are affected by society one way or another. But this is a pertinent factor when we talk about substance use in teenage years, in adolescence. And it plays in how it basically would start with just a general mention by a peer who has probably tried something, and they themselves could be under a separate set of friends who are trying this, or they have somehow discovered this substance. So given the social convention of looking cool or not being the odd one out, adolescents are sometimes caught in the web of trying out and then unfortunately over a period of time maybe even getting addicted to certain substances. So it's a very important factor to consider.
So what are the other factors to it?
There are a number of other factors. For example, socially, yes, like we spoke about peer pressure, but it is also possible that an adolescent or an individual may come across somebody in their family being involved in some sort of substance use. It may not be at the level of addiction, but they're exposed to it. Sometimes these questions go unanswered. Then if you go by cultural norms, you yourselves may be seeing that sometimes boys are expected to be men, and hence, they can try something like alcohol. But that influence can have many other, these can have effects that may run out of control. In certain cases, there is also a genetic predisposition. For example, a pregnant mother may have ingested certain substances, and that can really affect the genetic makeup of the child that is to be born. So social, genetic, hereditary, as well as, cultural factors sometimes play a factor, play like it's like a whole combination, a permutation of things that may happen.
So how many different kinds of substances are considered under such conditions or disorders?
Clinically speaking or medically speaking, and there are, say, over 8 to 9 separate categories of substances, and then there are subcategories under each. So some of them you may have heard, some of them are not heard by the medical terminology or the medical recognition that they are given, but they could be over 8 or 9. Sometimes new substances are added based on the development of different other medical issues or psychological issues. To give you a general idea, I would begin with something that we most commonly hear in our society: alcohol. There is also the use of cannabinoids. You may hear them by different other names, but their basic influence is that, you may hear terms like marijuana or pot. So they come under the category of cannabinoids. Then there are sedatives that are medications, like I highlighted earlier, that in certain cases, it's a legal substance. But the way that it is used without medical advice, that's where the complication occurs. There are also considerations for things like stimulants, in which, to a level, caffeine is also included. So just to give you that idea that there are purely, there are drugs that come under a lot of medical knowledge or medical use, and then there are also substances like coffee, caffeine-related products, which you may consider harmless. They may not be as harmful, but yes, they have to be taken under consideration when they're used to a certain extent. We also talk about nicotine and tobacco and a number of other drugs. So lot of, at least 8 to 9 categories and a number of substances that are considered.
So what are some of the first signs a parent or a loved one may notice related to teenage substance abuse?
Initial signs would be, or I should say the signs that really pop out are mostly behavioral. So a parent may notice that their child is behaving very differently from their usual way. They may start to stay aloof, or they may act out and get angry all of a sudden and to a very severe degree. You may also notice the sudden change in the group of friends that your child is mixing with, which causes alarm. Suddenly there's a complete change in the number or the type of people that your child is mixing up with. Other alarms also occur, say you find certain drugs or drug paraphernalia, for example, syringes, or you find certain scales. And the combination of it usually may lead parents to feel concerned and alarmed about what may be going on in a child's life.
So what can be done if an adolescent and or the family find themselves in such a situation?
The most important thing here comes regarding the support that we can give an adolescent, right? And you yourselves being of that age can relate to the factor that, talking to your parents, to your loved ones, is extremely important in any challenge. And with a challenge like substance use, it is very important for parents to talk to their children. Say you want to, we encourage parents to start bringing up this topic like you have. So, give them enough information. If you see that your child may have gotten involved in the use of certain substances, you may have to, of course, intervene, talk to them about how long it has been going on and how concerned you are. It doesn't guarantee that the child will open up, but in those conditions and otherwise also, it is highly recommended to reach out to a professional, whether it's your family physician, whether it's a psychiatrist, a clinical psychologist, a rehabilitation professional as such, so that help should be immediately sought. If you also talk about making certain, taking certain steps to make children aware, like I previously mentioned, schools can also get involved in this discussion. Talk about how children may be subjected to this, how may they come under that influence. So for an adolescent, it is very important that they talk to a loved one. If a loved one is discovering this, for example, a parent, talk to the child, but concurrently also reach out to a professional as soon as possible, actually.
Okay, thank you so much for answering our questions and helping us educate others on the issue of substance use and substance abuse. And we hope to have you back for later interviews to learn more about your knowledge on different topics.
Thank you so much for having me.
If you enjoyed this video and want to hear from us again, please like, subscribe, and hit the little bell icon to get a notification when we drop our next video.